besides Circleville, and Jackson, Ohio. And we're looking at possibly 2 other locations down in that area. One happens to be in Scioto County, and the other one happens to be in Highland County. So we're looking at possibly even expanding to 2 more locations. The original vision was to provide a place for women to come to receive a free and confidential pregnancy test without judgment, and it quickly grew into a safe haven for women to discuss pregnancy options. Since that time, our vision has broadened and is now our desire to be the first choice that people turn to in our communities to provide resources and knowledge in regards to unplanned pregnancies, sexual integrity education, parenting mentorship, and healing for those that have had a past abortion decision. Our goal is to provide the care in a compassionate way that brings hope to all that we encounter through the love that we've received also through Jesus Christ. Our mission is to honor God, offer hope, and promote life and empower families. We believe that strong, healthy relationships and families are the core to having a strong and healthy community. Our goal is to see families restored and empower women to success while raising a family. Over the course of 20 years, we've been able to establish a wide variety of networking within our communities with doctors, community resources, and other nonprofit agencies who we collaborate with providing anything from a free ultrasound, if they're abortion-minded, to helping with addictions or abuse, and to assist them with immediate needs of food or housing. In 2013, we provided 4,981 services overall to women and men. We help dads also. We use an Earn While You Learn curriculum process. The moms and dads clients come weekly for a 45-minute to an hour session, and they work with a trained life coach. They watch videos and have a worksheet to answer questions as they work through those videos. Generally, there is a homework assignment to recap the information that's provided, and the clients take it home and bring it back to them with their next session. At each session, the clients earn credit, what we call baby bucks. They receive baby bucks for each of the sessions for things like homework completed, for outside assignments such as attending well baby checkups with their doctors, keeping other community appointments for like social services that maybe they go to, and they can get things for attending support groups if maybe they're dealing with addiction or whatnot, and attending church. While with the baby bucks, they can then purchase items from our mom's store. The items that they can purchase are things like cribs, car seats, strollers, diapers, wipes, all those things that they need to get ready for the baby. The curriculum itself covers a wide variety of topics, from infant and child development, baby care, special circumstances such as SIDS, addiction, shaken baby syndrome, things like parenting, budgeting, and finances, those kind of things, along with Bible studies. Outside of the center, we provide an abstinence until marriage education program in our local schools and with the area youth groups at churches. Through that partnership is called Relationships Under Construction. And RUC for short is a federal and state mandated, meets all the federal and state mandated guidelines for abstinence education in the schools, in the public school system. And last year we taught at 16 different schools and saw 2,769 students in the counties that we serve. We also work with the local court system and Job and Family Services, and they refer clients to us for court-ordered parenting, and then Job and Family Services who are dealing with taking the children out of the home and those kind of situations about the mothers trying to get their children back. One area that we're really trying to focus on expanding is our presence within the colleges in those areas that we serve. This year, we've been gathering that information and working on building relationships with those colleges in those counties, because the women in college are at the highest risk of making an abortion decision. Our goal is through education that we can reach them before they even have to make that decision. Our funding actually comes from 4 main sources. We have what we call a Change for Life baby bottle campaign, and that's where we give a bottle and they fill it with change and return it back to us. And change adds up, believe me. So then we have an annual fundraising banquet, and then we receive some local and specific grants, monthly support from local churches and individuals just like you. Lastly, I would like to talk about, we offer a post-abortion healing group called Surrendering the Secret. Abortion has been a readily available part of our culture since its legalization in 1973. Since then, almost 60 million abortions have been recorded in our nation, and 1.3 billion worldwide since 1983. Statistics show that close to 43%, 1 out of 3 women of childbearing age have experienced an abortion. These are your sisters, your wives, mothers, friends, and could be the woman sitting right here next to you tonight. These women carry an incredible burden of silence and heartache. Many struggle for years with repressed memories, guilt, shame, and depression. Most women feel they are not allowed to talk about their abortion experience, especially in churches, due to criticism. The truth is, many women who have had an abortion suffer from symptoms of post-abortion grief and trauma. Most often, neither the medical community nor the church understands abortion as a risk factor in a woman's physical, spiritual, or emotional health. Many of these women, after their abortions, have gone on to lead lives of promiscuity, addiction, depression, and other self-destructive life choices. Slowly, after 40 years of abortion in our country and a woman's so-called right to choose, we're starting to hear their stories of pain and regret. And at Elizabeth's Hope, they are able to find a safe place without judgment to share their stories for the very first time. In summary, Elizabeth's Hope and other pregnancy resources centers are truly the frontline missionaries in our country and around the world who stand in the gap fighting against the norm of society for the protection of life and marriage. As we teach our youth and young women the importance of their sexual health, the gift they have been given in their fertility, and that there is no such thing as safe sex outside of marriage, but only in a loving, committed relationship between one man and one woman for life, it is then and only then that we'll be able to see lives truly saved, families changed, and communities restored. Thank you. Slow down when I'm not nervous.
Does anyone have questions for Lisa? Ginger?
Lisa, are you under the umbrella of Heartbeat International?
Yes.
Okay.
Yes. We're under Heartbeat and CareNet International. We're affiliated to both of those. We're what you call a non-medical center under them. So we don't provide the actual ultrasounds there at our facility, but yet we have connections that we've established with area doctors that are pro-life, and we can refer over to them at any time, and they give them a free ultrasound.
Can you tell us about the women? I mean, their education, like your clientele.
Well, the moms that we usually see are either your high school kid, teenager, or poverty, because we're in southern Ohio. A lot of them just need assistance for that. But then we're really encountering a lot of addiction. Heroin is crazy. And so we encounter, women like that also. But a lot are the poverty area, but the ones that are abortion-minded, and those are just the mom's clients. The ones that are actually abortion-minded, they are more your college, educated, come from a church family, So, I mean, it's happening in our churches and stuff like that. Women are still making those decisions. So we're seeing the women that are abortion-minded are more educated, actually, making that decision. Because it's a decision that they want, they don't want to change their life. They think they're not going to be able to go on and get an education and those kind of things in that situation.
Other question? I know that you practice teaching NFP, or you have volunteers that also provide natural family planning services there. Is that you have in the past?
We have some, the whole connection, even with us, even with the Catholic Church, we have a woman that we do work with St. Peter's that happens to be located right next. We rent from a Catholic church right next to us in Ross County. And there's a woman that's been certified for the Creighton model and stuff. Judy Harness is her name, and we work with her to help us with that. But then we also have resources from Heartbeat International on fertility, and the importance of fertility is basically exactly the same thing. So, yes.
The women who have gone through abortions and they need to talk to someone, who talks to them? Is it a social worker? Is it a therapist? A priest?
We have a support group that we've been trained in, and actually myself and April are trained in what we call surrendering the secret, and it's basically a Bible study, and they come to work with just a network of a group, and it's usually a private group. People don't know, and we've actually just got started doing it because prior to, I've been the executive director for 2 years now. And prior to that, we didn't have a lot coming in. You didn't hear a lot from these women and stuff. And since then, we've actually been making a lot more connections and being able to do, I think, what is our second group that's going on and stuff. So it's basically a group like that. You know, they don't feel like they can go, a lot of them don't feel like they can go to their pastor or to their priest, or, you know, it's a shame-based decision. And also the fact that you have murdered your child or killed your child. So that it's very hard for them to come forward and to talk to just anybody. So, but April and I happen to be trained in this particular, so that's what we use. And I'm a post-abortive mother myself. So that's kind of my passion, my kind of area that I like to help women to understand that they can be forgiven, that God does forgive them, and that they can receive freedom from that. So, hope that answered your question.
Yes.
Okay.
What size staff do you have?
Actually, very little. We have a center manager over the 4 centers, one admin assistant, and myself. However, I'm the only one that is actually full-time paid staff. The rest of them receive our part-time staff, and they get 30 or less hours in a week. So kind of small. And then we have probably 45, anywhere from 35 to 45 volunteers at any one time that come in, get trained, stay. Some of them stay for a very short period of time. Some of them stay for 2, 3, 5, 7 years and stuff. So that's who else helps us as volunteers. Yes, ma'am.
What do you attribute the increase of women coming forward for help this way? You said in years past they were afraid to do this, but now they seem to be coming forward more.
I think our experience in that we're seeing that is because of we're going out and sharing our stories. And I looked at April, but she's not post-abortive. I'm sorry, I don't want to give that insinuation. I am. And going out and just sharing the story and having the courage to go out, it takes a lot of courage to go out and stand before a group of women and say, this was my decision and my story. And we don't have enough time for me to go into that. But I'd be more than happy to come and share anywhere that God opens up a door. I'm more than happy to go and share my story. So I think that that's why, is that as someone comes forward, they feel safe to be able to come forward also.
I was just going to say, I'm a health teacher in Olentangy. We had relationships under construction in our building, and they do an outstanding job.
Yeah. Yeah, relationships out of construction is out of Delaware. Kathleen Wood is the writer of that curriculum, and she happens to be in Delaware, Ohio. So she's right in our back door, and we've been it's just a great collaboration with us, and they're all over in many counties in Ohio, and especially in Appalachia, Ohio. So, yes, ma'am.
In your, and maybe you covered this as I was, in another place.
That's okay.
Sorry. In your counseling, do you cover the option of adoption, and how is that handled through your organization?
Oh, yes, of course. That is definitely an option that we explore. Now, do we see it very often? No. Because most of the girls that come in, they want to keep their babies, especially in Appalachia, Ohio. They want someone to love, and they feel that that person is that one that's going to love them. And so they don't want to get rid of their children, in most circumstances. They don't. And so, adoption is not even something we go into with them because they decide they're going to parent the child. Now, do we try to help them along and think through that process? Because if it's a really immature person that has a lot of problems and stuff like that, we do try to open that door and say, let's just look at this. What would life be if you kept this child? What would you be able to do if you gave that child up for adoption, which is the greatest move, sacrifice of love you can make. So we explore those kind of options with them also, but we haven't had a lot that actually take that as an option. I think this year, surprisingly, I think we've had 2 that have taken, that have decided to put their child up for adoption. So it's not like a highly picked choice. It's either parenting, and we don't see a lot of the abortion-minded other than from the college crowd. Most of them want to keep their children and come to us for the services that we can provide to help them get through that.
Any other questions? Thank you for sharing your story.
Thank you.
Next group, I just want to let you know that we actually have provided funding for Elizabeth's Hope through St. Peter Parish and its Mission Church, which is in Pike County in Waverly. So our churches, this is an ecumenical ministry. There are several churches that support Elizabeth's Hope, I believe, and our parishes down there in Pike and Ross County help support the services they provide. I'm excited to hear that you're going to hope to expand into Scioto County because there's already a ministry started there for post-abortive healing called Raphael's Hands, and that was born out of the parishes down there. So if any of you want to know more about that, let me know. The next group that we're going to have speak to us is Catholic Social Services with Rachel Lustig and her guest Jamila. They're going to talk about one of the programs that they offer. Did I pronounce your name right, Jamila? Okay.
All right, thanks so much, Amy, and what an honor to be a part of this incredible group of women here. To follow in the heels of your story, that's just really powerful. Thank you for what you do, and in that part of our state, that's so important. So I'm here to tell you a little bit about Catholic Social Services. I'm going to give a brief overview, and then we're going to hone in on one of our programs, which is very close to my heart. It's our Pathways to Hope program, which helps women who are survivors of domestic violence to build a new life for themselves and their families. So we'll start kind of at the very beginning, which is our mission. I have been the president and CEO of Catholic Social Services for about a year now. And so each time I go back, I have the opportunity to go back to our mission statement. It kind of feels like a little prayer. Well, what's jumping out at me right now is this concept of advancing dignity and potential. Because I think that's, to me, it's so much about what it is to be Catholic, that we would never just provide for somebody's temporal needs, but that we very much recognize that there are human persons in need of love and that much more. So I love that about our mission, that it captures it there right at the very beginning, the dignity and the potential of people. Catholic Social Services runs 14 programs. We serve 11,500 people in ways that strengthen families. And we provide these services because we are Catholic, not because they are. Our questions are never, what religion are you? It's, are you hungry? Do you need some help? Our services focus in on 3 areas: families, seniors, and relief. So our seniors services, you know, I can stand here and brag because I've been on for only a year. People, it's incredible the work that the social workers do to provide support for seniors. So we kind of support people to make it possible for them to stay in their homes. The case management type of support, so if they need help going to a medical appointment or managing their funds or reading their mail as early onset dementia may make it more difficult, that's the kind of thing that our caseworkers will be there. But recognizing that, you know, more than those temporal needs, a lot of what we do is also companionship. Because social isolation is as bad for somebody as smoking and obesity. And it's very difficult to be caught in your home. In fact, last year, we mobilized 107,000 hours of people visiting other people. Just incredible work of presence and companionship. I was telling Eileen just before we got started that I have the equivalent of about 42 full-time staff. But I have the equivalent of 57 full-time volunteers. Can't do this without the support of people in the community. We serve about 1,455 clients with over 500 volunteers, 110,000 volunteer hours. Like I say, I can brag up here, 99% satisfaction rate with our services. Kind of awesome. And we do services in several areas: transportation, friendly visiting. Thanks to you all, we do service Saturday. So not only are we check, I mean, for us it's as much about impact as it is about, we want to make a difference in people's lives. So our clients are meeting their goals. Our clients are less isolated. Our clients, you know, they're able to make it to their medical appointments on time. Very important stuff. We have a pretty good reputation in the community, so that's nice to know. Our second area of service is in the area of relief, and I'm going to go pretty fast because I think the better part of my presentation will be when I am not talking. So, we provide relief services, support services to people in the community. About 9,000 people come to us for emergency food, utility assistance, all the types of support that are in the relief area. We really do try to be more holistic in that. So, you know, while somebody comes to us for food, we've got several partnerships that make it possible, like our partnership with Mount Carmel, that makes it possible for them to get a health screening, and makes it possible for them to get some legal assistance. And so they came in because of an emergency, and we recognize that there's probably some more roots to the issue. How can we help to provide that? So these are a couple of the areas that we're providing support. Our Guadalupe Food Pantry serves the growing Hispanic population on the west side. Many of the rest of the services are in the Portsmouth-Scioto County area, where we do a neighbor-to-neighbor program and linkages and referrals. I just love this story because I think that speaks to the goals that so many of our clients may have. Maybe they need a little bit of food, but what I truly want is to have a good and lasting relationship with my husband so that we can together raise our children, because we want our children to be the best human beings they can be. I could probably put every single one of your guys' names next to that quote. Our final area of service is about families, so strengthening families. We provide this type of support to about 1,000 clients. So, yeah, here you'll see on the right-hand side the different ways that we do that. Our counseling services, we do specialize or focus on maternal health counseling. Our Pathways to Hope program, which you're going to hear a little more about. Our Payee program, we manage the funds of about 580 people. And these are people who are either developmentally disabled or who have dementia, or anyway, they've lost the cognitive capacity to manage their own funds. So they become highly vulnerable to exploitation. Many of our clients have had significant issues of somebody taking advantage of them, which puts them in spirals them out a little bit. So the Payee program pretty much stabilizes their situation for many of the other supports. Our Home Choice program is about helping people who have been sick transition back into their homes. Maybe they were in a nursing home for a while and lost the savings necessary to, put down a deposit. And then we do family strengthening and violence intervention, very similar to your program, for families who've been court ordered to come to us. So here are a couple of instances about what ways we've been successful. But right now I want to transition and talk a little bit about the Pathways to Hope program, because that's the one that I want to focus on today. Anybody want to guess what percentage of women have been victims of domestic violence?
98.
You may be right. Don't know that many report it.
30%.
30%. I've got 1 in 4, so I think that's very close. Very close. What we also know is that it takes, if a woman has been victimized by violence, that it usually takes her 7 times to actually leave the situation. So the program that we've been able to establish, our Pathways to Hope program, is for survivors of domestic violence who really want to build a life for themselves, who may find themselves in a situation of not having a house to go with. We work with survivors and their children so that we can provide them with a home support and help them to get a job and transition. We'll work with them providing case management for up to 2 years.
I'd like to know, what is it that we don't understand that can help Carmel? That's your name. What is it that we need to get through our head?
Sometimes we think that, you mean as far as?
Just about the whole situation of being stuck in a cycle of abuse
We think that we can fix that person, but we can't fix that person. That person has to fix themselves. And we need to learn how to put ourselves first, because that's what I learned. This was my first advocate, and I love her to death. I learned how to put ourselves first and not the other people, because if we don't work on ourselves, we're going to find ourselves repeating the same cycle over and over and over again. And that was my problem. I thought that I could really fix this guy. I thought I was like, Mrs. Fix It. But I couldn't fix him at all, and he was never going to change. I could have just ended up dead. There's so many people that end up dead. If you look at the statistics online, many people end up dead, and some of them never reported. Yeah, my baby was born so early. She was only 4 pounds, and it was just like, it was scary. It was very scary. She's doing good, walking and trying to talk.
That was my question. So this was a year ago, Jamila? A year ago, not just like a month ago?
No, a year ago.
Okay. I kept thinking, oh my gosh, I thought I hated school starting.
It was the first day of school.
Oh, I can't even imagine. Thank you for sharing your stories. Any other questions?
We're really proud of this program. I mean, there are very few where you have the opportunity to kind of be there for the amount of time that it takes somebody to make such a significant change in their life. And it's an honor to be able to, when somebody has the courage like you do, to make sure that you can, make that next step.
Is this kind of a pilot program? Is this going on in other places in the United States, or are
It's based on
ground here? Or are we?
It's based on best practice research of how to provide. It's tapered. We work with them for 24 months. The first 3 months were pretty intensive in that, so we're paying for the rent, and then the 4th month you get about 60% of it, so that we encourage people to be working full time. And we have 5 milestones that you kind of meet over the course of those 24 months, and the last one is to see yourself as a survivor, not to be defined by violence. So there are similar styles of programs. We get some of what we do is funded by the Office of Violence Against Women from the Department of Justice, and some of it's private, a lot of private donations.
Are people referred to you? How do they
find out? Jamil mentioned Choices. That's our primary referral partner here,
Oh,
and a
that's
big
the
partner
primary
of ours.
place.
They're a domestic violence shelter here, an emergency domestic violence shelter here in the community.
How is this related to what used to be Coalition Against Family Violence? It has a new name now.
Coalition Against
The
Family. It's now the Center for Family Safety and
There you
Mental
go.
Health.
Yeah, thank you.
You might be able to speak to that better than I can. Kim, you want to take that?
Because we're involved with them for up to 2 years, where they're not involved with them as that long a period of time. They're going there, they're working with attorneys, they're, from my understanding, attorneys, social workers. Our case manager is a licensed social worker, she's a master's in social work. And we do work with them for a period of 2 years. And we help them with their rent. Like Rachel said, we taper down. We do 100% for the first 3 months, taper it down to 60%, 40%, 50%, 40%. And then we also help with other things, utilities and things like that, and helping them get set up in their apartments.
Yes.
Is your services, are they in multiple counties in Ohio? How can we find out what counties where we can refer, like we could refer some of these girls to you, because we get several that are.
In that situation?
Yes.
Kim again.
This is the only one in Franklin County, and in order to be referred to our program, they have to be on the federal choices. They're the domestic violence specialists, and that's what the girls from.
Okay, so it's not something that County Social Services has everywhere.
Not yet.
Not yet.
Take that to scale.
Well, we'll pray for that right now, because it's in much needed resource.
Thank you. Yeah, we appreciate that.
And would the contact person be Laura?
Anybody on our staff can help get you to contacted with the right work. Kim's actually the better one, so
Are you talking about donations, or are you talking about services?
No, to connect with services, like if any of our women, if we're looking
for somebody who needs these services. You know what, let me finalize my presentation. Sorry, we close it out. Get help. It's not working. Is it freezing? So anyway, there are 4 things that we're going to ask for your help with. And the first is your prayers. I mean, pray for the courage of the people who come to ask us for help and for our own efforts. Yeah, go ahead from here. The second, if anybody you know is in need of help, you can call our just main line. We know how to get in touch with you, and if we can't provide the service, we know how to get you in touch with a lot of other community organizations. So please take advantage of our services. As I mentioned, we can't do this without the volunteers that we have. So that's our third thing, our third ask. And then volunteers doubling our impact. Do I have the picture of the Marthas up there with the, oh, sorry. And then we do also take financial support. But 2 things I'm going to draw your attention to in the green folder. One is the service Saturday. It's the green sheet, I believe. The green sheet. So that's our service Saturday thing that Amy mentioned, that we do put together a Martha's group to do it. And the second is we are going to be hosting a training session on Bridges Out of Poverty, which changed my perspective of what it is to effectively alleviate work to reduce poverty in our community. And so we're convening some people here after our annual breakfast with the bishop, and we'd love to have you come. So a couple of things to just let you know. Now I'm taking more than my time.
Really, the next story is a good one because it's New Directions Career Center, and they help women re-enter the workforce or enter the workforce for the first time. One of the greatest problems with abusive relationships is that oftentimes women are found without financial resources at all, because that's one of the controls that's placed over them. Even if they do have jobs, a lot of times they have to hand over their paychecks. So New Directions is a great way to help women empower themselves through education and finding work. And this is Linda Danter. See if I can juggle all these things at once. Okay, first of all, our mission is to empower women
in transition to achieve and maintain economic self-sufficiency. And the type of transitions that bring women to the center are things like domestic violence, and we have over half of the women who come through our programs self-report that they have been victims of domestic violence at one time or another. And we figure it's higher than that because not everybody is comfortable with admitting that they have been in that situation. We achieve our mission through our programs and services that are targeted to provide career counseling, education, and employment workforce development types of training so that women can enter or re-enter the workforce and be able to support themselves and their children. Did you know that 43% of female-headed households in Central Ohio live in poverty? 43% of female-headed households in Central Ohio live in poverty. The households that are headed by women with dependent children, that is the largest group of people in poverty. And, you know, it's how are we going to help people? How are we going to ever address the poverty issue if we don't help women to be able to have careers, have jobs that are going to pay a livable wage to support themselves and their children, and also to have those women become strong enough to be good role models for their children so that you can ultimately break that cycle. So that's kind of what we are all about. I think that we started in 1980 and have been very successful in our 34 years. We have an average of 75% of our women who go through our programs who have gone on to additional education or training or to get jobs that have led to economic self-sufficiency. That's pretty astounding for a 34-year track record. And I think that is, in my mind, that is one of the best things we can do to help to really break the poverty cycle. You know, it's certainly basic needs are important to help people stabilize their situation, but if we put all of our money into basic needs, we're creating another welfare system and we're not helping people to help themselves. And most of the women who come to us really want to turn their lives around. They want to be good role models for their children. They want a better life for themselves and their kids, and they just need a helping hand to be able to do that. They need somebody to help them to develop a plan for themselves, to find the resources, and by resources I mean some of the programs that are represented by other agencies here, and we partner with a lot of you, as well as the financial resources. And a big part of what we do in our programming is helping women to develop the confidence to know that they can provide for themselves and their children. I would say that's one of the biggest things. We have women who come to us who are from all walks of life, all educational backgrounds, different socioeconomic groups. You know, it can only, most of us in this room probably have pretty comfortable lives, but think about one day can turn that around by an occurrence that you're totally unprepared for, whether it's the death of a spouse, whether it's a disablement of a spouse, whether it's a divorce, or whether you or somebody close to you becomes a single parent unexpectedly, or whether you are faced, as some of our women are, as a grandparent raising grandchildren, something you never anticipated. And maybe you thought you were retired or were getting ready to retire, but all of a sudden you have that responsibility. Or escaping the situation of domestic violence, which is one of the other things that was already mentioned. So we're very passionate about what we do. We feel that we have a good track record of being able to help women to truly change their lives. Our programs are holistic in nature. We not only help women to develop a career plan for themselves and to find the resources to be able to achieve it, but to find resources to help them get their personal life stabilized in the meantime. We're very pleased that a lot of our women find scholarships with our help to be able to pursue additional education and training if it's necessary. Our partnerships, as I mentioned before, are really important, and we focus through our partners on helping to meet the needs for housing, for food, for health care, a variety of different services that women need for themselves and their children so that they can truly become economically independent. A lot of what we do also means that we have to prepare women for a changing workforce. And today, the workplace of today calls for hard skills, such as customer service skills, good communication skills, computer proficiency, as well as soft skills that employers value, such as conflict resolution, time management, and problem solving. So we prepare our women for all of those kinds of barriers. And some of the barriers that really keep women from being able to get that additional education and training, two of the big ones are transportation and childcare. You know, you can't, you think about if you earn minimum wage, which is a little less than $8 an hour now, and if you look at that over the year, that doesn't even pay for childcare in a lot of situations. If you have to pay for a daycare center care for your child, or once you do, there's not enough left to be able to live. So we have to help women be able to get better jobs and to be able to have the kind of resources they need to raise their families. I think that we have, in addition to let me just say, the child care and transportation, we've been very fortunate, and that is how our funding from the Catholic Foundation has been used through the Gould Fund. We have been able to use that grant to provide for transportation and child care so that women can participate in our programs to be able to get that help they need to get those better paying jobs. A third area that's really important is to have the kind of professional clothing that you need to be able to network, to go out for that job interview, and also to be able to start a new job with the appropriate kind of clothes. And we have an in-house boutique called Bee's Boutique that serves women in terms of meeting that need. So anytime that a woman completes one of our programs, she is automatically eligible for 2 free outfits from our boutique. And she is assigned to a volunteer who serves as a personal shopper for her to help her be able to put together outfits that are appropriate for whatever her needs are, whether it's a job search where she may need more professional business attire to go to networking events or to go for job interviews, or whether it's to start a new job. And most new jobs now require business casual, but they need to understand, our clients need help with knowing what might be appropriate for business casual depending on where it is that they're working. So that is a big focus, one of the additional services that we are providing to our clients, and that's the one thing that I wanted to bring to your attention today and let you know about a particular area or project that we really need help with, and that is providing undergarments for our women. We have no trouble getting professional clothes. Most people have gotten rid of their suits in their wardrobes if they're working, but suits are still necessary for going for job interviews, so we get lots of beautiful things. We get accessories also that are wonderful, but we have women who don't have bras, who can't afford a bra. Bras are expensive, and may not have other panties, and those are things you cannot just, have people donate. So we really could use some help with some funding that our plan would be to work with one of the stores in town like Macy's, and so we worked with quite a few that I'm sure could arrange a relationship with, so that we could actually schedule a woman to go to a store at a particular time and get fitted for a bra if she needed it, and be able to get the kind of undergarments that she needs to go with those beautiful clothes that she's able to get through our boutique, and feel good about herself and feel comfortable when she goes out for a job interview or to start a new job. So that would be our major need right now that we thought would be a good one for to present to all of you as something that you might consider. I know my time is limited. I left one of our program brochures on your chairs, and please take a look at that. I'd be happy to answer any questions you might have about our programs and services. I'm grateful for this opportunity to be with you today, and I'd be happy to hear from you. Yes, thank you. I almost forgot my slides. I have a couple of slides here from just from our classes. This is one of our program counselors, and we do use licensed career counselors to work with our women. This is one of our classes with the, well, it's not working. And this is actually another classroom shot with one of our volunteers assisting one of the program participants. And if you scroll on to the next ones, these are just some of the women who are graduates of our program, and they are actually modeling some of the outfits that they have gotten from Bee's Boutique. We have a little fashion show fundraiser. And then the next slide, 2 slides actually, are women who we really worked hard last year to help a lot of the women who went through our programs to get scholarships. We had, I believe it was 14 women who received scholarships last year to pursue post-secondary education. And 4 of those scholarships were full 2-year scholarships. And that really makes such a difference when you're talking about women who are trying to work, raise their children, and go to school. It's just such a strain on them to be able to have some financial assistance so they can takes off some of the pressure financially. And for some of them it means that they're not going to end up with huge loans when they finish their degree. But these women are all wearing outfits that they have gotten from the boutique, so you can see that they're different shapes and sizes, and they have access to a lot of wonderful exterior clothes. But again, having those undergarment foundations can make a real difference for them. So would be our concern and our request.
Did this used to be the Center for New Directions?
Yes, yes it did. We started in 1980, and we're called Center for, well actually our first name was the Displaced Homemaker Program, because those of you who have been around as long as I have know that in 1980 when we started, the divorce rate was high, there was no child support enforcement, and overnight a woman could find herself, her husband gone off to Argentina with a sweet young thing, and leaving her with 2 or 3 children. And she was terrified, had either not worked or was working a little part-time job because she enjoyed it, and all of a sudden she's going to have to support herself and her children. So that's how we started, was as a Displaced Homemaker Program, because a group of women sitting around a kitchen table said, we've got to do something about this. And they started this program to help women to be able to get back into the workforce. And then I think it was about maybe 83, 84 when we changed our name to the Center for New Directions. And then over the years we have expanded our focus to try to meet the changing needs of women who need to get back into the workplace.
Yes. Are there many employers that provide tuition reimbursement programs? Because I was a single mother who was forced to go to work and found out that my employer had tuition reimbursement and literally was working a full-time job, keeping 3 kids in Catholic schools, keeping an 8-room house, going to school summer, fall, winter, and spring, get my degree, but hadn't paid my tuition to Franklin University. So I wondered if there were any employers.
There are a few employers, but not many. And there are also, for example, I know some of the hospitals sometimes will have programs to help if you want to become a nurse or something in the medical field, will help to underwrite some of your costs. But it depends on the employer. But there really aren't a lot of those around these days, unfortunately. Other questions?
Does somebody need to be referred to you, or can they just come in?
They can just come in, or they can be referred. We do have, for anybody who's interested in our programs, we run an orientation session almost every week. We have a couple, And we have a variety of different programs. So anyone who's interested, we'll ask you to come in and go through one of our orientation programs to learn more about our programs and services, to figure out which one best meets your needs. For example, somebody who just recently lost their job, has been working, may have more skills, they may need a program that just helps them to kind of brush up their interviewing skills, get a dynamic resume together that's going to be competitive in today's job market, and maybe that's all they need. But somebody else maybe is thinking about, either needs to change their career or maybe is burned out and wants to change their career direction. They're going to need a different kind of program to help them explore what their options are with the education and experience they have, and help them to put together a plan and then figure out how they're going to achieve it. And then women who may be have a lot of other kinds of problems bearing down on them, whether it's that they've escaped a situation of domestic violence, or maybe are on public assistance, or whatever, have some additional kinds of issues to be addressed, and that will be a different program still. So it's all individualized, and our classes are kept small, and there's also some individual career counseling that goes on. And I think one thing that sets our programs apart is that we don't just run a class and when you finish with that class we say goodbye and good luck. We will work with women as long as they need us in order to reach their career goals. For some women that's 3 to 5 years. For other women, it may be 6 months. It just depends on your individual needs. So we're there.
A very quick question.
Sure.
How many women would you say you have a month who need the undergarments? And how soon could you have a relationship set up?
I left a sheet of paper on your seats that has a little bit of more information. I'd encourage you to take a look at that. Last year we served 205 women through the boutique. We served close to 1,000 women in our various programs and services, but not all of them needed or took advantage of the boutique. I think that number is growing, but I would say probably at least half of those women need undergarments. And in terms of how soon we could get a relationship set up, I would say we probably could make that happen within a month, because we've worked with various people, and with a little lead time we could certainly try to make that happen. You're welcome. Thank you.
Where does most of your funding come from today? Are you ever in a situation where you have to turn people away due to lack of resources?
No, we've been actually growing our budget as our client numbers have grown. So far we have not had to turn people away. There have been a few occasions when we've had to put people on a waiting list and have them come back when the program was next offered. But we've been able to serve everybody in a fairly reasonable amount of time. Our major funding comes from a variety of grants. We have grants we get from probably close to 20 different sources, from our own fundraising activities, and also from donations, and from United Way Women's Leadership Council. That particular group of women, they fund our E3 program, and E3 stands for Educate, Empower, Elevate. And that is actually a program that is at least 2 years long, sometimes 3 years long, that is designed for women who are motivated to pursue post-secondary education in order to fulfill their career goals. And there are a lot of incentives associated with that program, as there's an initial in-class session to help prepare women for going back to school or getting back into some type of training. It doesn't have to be college. It can be a non-traditional career for women. Like, we've had women who've gone through truck driving school. We've had women who've gone to spa school to become anestheticians. They do have to be trained for a job that will be around, is anticipated to be around for a while, and that will end up paying a livable wage. And when they complete the classroom portion of the program, everybody gets a laptop, which they can then use when they go back to school. There are incentives as they complete different portions of the program, which they can either use as they need to going through the program, or they can bank them till the end and then use them to apply toward books or uniforms or tools or whatever they may need for their chosen career field. And then, like I said earlier, we do help them to find scholarships, and the WLC is the group that actually funded those 4 full 2-year scholarships. And this is the 2nd year in a row that they have done that. And it is a competitive process, so the women who have graduated from the initial classroom phase of the program have to apply for that, and then they are they're selected by actually a group of people through the Columbus Foundation. It's totally impartial. So it's an excellent program for anyone who, if you know of anybody who really is going back to school or needs to go back to school in order to improve their lives, please keep that in mind.
Any other questions? Thank you, Brenda.
You're welcome.
The next group is Mount Carmel, and it's actually the Community Health Resource Center. Amy Peacock's going to talk to you about it. They're located on Mount Carmel West Campus. They've been a great new addition to the community. They're providing all kinds of services, and even better than that, they're putting all kinds of people who provide services together so that they can help each other and help the clients that they serve together. So Amy Peacock.
Hello everyone. You've been sitting for a while. Since I'm all about stress management and health and wellness, could you stand up for just a minute? And if you can just stretch your arms a little bit, stretch them up in the air. And then when you're done with that, roll your neck to the right. It's been a long day. You guys are patiently listening to all these amazing, phenomenal stories. And then roll your neck to the other side.
And then do we walk back to the table with the wine now?
And then you have a glass of wine. And then your shoulders, if you can roll your shoulders up.
Just even that, I think, makes a big difference. We walk around like this all day, like so stressed.
Go forward and then back. And then just for a second, just close your eyes. Let the wine kind of settle in. And just focus on breathing for just literally 30 seconds. Just focus on the breath going in your nose and out your mouth. You have nothing to do in this moment but breathe. As you breathe in your nose and out your mouth. Feeling your feet on the ground. Hopefully they're on the ground. And just focus on all the muscles in your body just relaxing. Being in this moment as you breathe in and breathe out. Take one last breath as you breathe in and breathe out. Now open your eyes and you can sit down. And don't fall asleep because we got 2 more left and I will be quick. But these stories are so inspirational, and we work with a lot of our partners here. Rachel and I actually started the exact same month, I think. Was it September, right? Yeah. And so I kept hearing about it, and we actually met in the same room. So what's exciting about the Catholic Foundation, same with Linda, that we met each other a lot through the connections and the collaborative that Amy has brought us together, which really helps because we don't all have the same resources. And so if we can maximize, say, hey, we don't provide that, but so-and-so does, and so we can refer and link because we need to maximize as much as possible. So I work at Mount Carmel West. Let's see if this works. So I work under the Department of Community Outreach, and so under Community Outreach is a part of Mission Services, and Sister Barbara is in charge of that whole division. And we have a lot of outreach activities that we do in the community, our Welcome Home program, and we have mobile outreach, so we have urgent care on wheels, and then we also have street medicine program. So I'm also we have crime and trauma, which is helping women with domestic violence and also with any victims of trauma. And so those programs are also as a part of outreach in general. So those are all a part of my team. I'm going to talk just a little bit about the Community Health Resource Center. I'm the manager there, and we started in November, so it's a very new program. And so it's a health and wellness center for the entire community, and all of our services are at no cost, and we get a huge amount of funding from the Gold Fund. And the Catholic Foundation, we wouldn't exist without them, so we're really grateful, and we're able to get a lot of different funding through them. So a lot of times, you know, people go to the hospital for episodic care and then they're sent home. This is a new model, and I think nationally we're moving towards this to try to look at preventative care and preventative services. So we're doing a lot in that area. So I started in September, we opened in November. That's what I said, we received a lot of different funding from different sources in our Mount Carmel Foundation and the Catholic Foundation. And so these are some of the services that we're offering. We do cooking demonstration. I'm going to show you a video here. It's just a quick video. And then we have cancer services. We have patient navigators that help guide people through the process. We have a Moms to Be program, which is in partnership with Ohio State. So I'll talk a little bit more about that. And it's an excellent partnership with moms that are pregnant and trying to help with infant mortality. We are 40, I thought we were 48th, but now we're 49th in the state in infant mortality. Did you know that as a state? Like, that is a huge deal. There are a lot of babies dying unnecessarily, and so there's a huge task force here in, all across the state trying to make an impact on this. Childbirth, education, breastfeeding support. The majority of the people that we see at the center at this point, 90% are women. And we do education with diabetes, Live Your Whole Life, we do employment education as well. And then we have different community meetings and coalitions. So here's our kitchen, our cooking demonstration kitchen. And we also have a consumer health library, because a lot of people, once they're diagnosed with something, they think of somebody says, hey, suddenly you have diabetes or cancer or whatever the issue is. And I personally don't understand terminology when the doctor talks to me. It's like a whole nother language. And so being able to break it down for people so that they can understand the language and break it down into lay terms. So there's a library available for people to help educate them. We've hosted almost 500 activities. We've had 4,500 visitors. I've attended a lot of different community events and did tours and presentations. And so we've partnered with a lot of different organizations in the community. And at this point, I'm the only staff person running the center, but as of last week, we posted our first position. So we're going to start growing little by little, so we're very excited about that too. So the Consumer Health Library I talked about, people can use computers, and we're doing computer training. And then these are some of the partners that we work very closely with, in addition to so many other programs, a lot of different organizations. So I'm going to show you the video. It's just literally 1 minute. So to just give you an idea of some of the programs that we're doing. And our main focus is nutrition, obesity, parenting, and prenatal programs, and also diabetes. So in this last 6 months, we've been focusing a lot on the infrastructure, getting things up and running, and just a little overview. We work with the College of Nursing too, so we have the College of Nursing students. cooking classes, we have a long waiting list now. And so now we have a lot of different members from the community, from the Franklinton area. We primarily are serving low-income, underserved women. And as people come into the center, there's group building that happens because there's something about cooking, right? We always meet in the kitchen, we all talk in the kitchen, and so that's what's happening with cooking. And people in our cooking matters, we're partnering with local matters. And so everybody has their own apron, they have their own cutting board, and they are able to actually participate in the cooking class, which you saw some of those pictures. And so through that engagement, people are learning healthy ways to cook, and they get their own, every time they have a grocery bag full of supplies that they can, or ingredients to use for that recipe that night. And then they have a copy of the recipe, they're interactive, excuse me, and then they get, it's a 6-week class, and we had 100% graduation. And you know how hard that is for a 6-week class, for all of us to go to 6 weeks. It's hard to find that. And people are lining up at the door, they always come a half an hour early. As a result of that, we have a really long waiting list. And then we also have a program with our Mount Carmel chefs. You saw them in there. I've been really impressed because they really care about people in the community, and there's this compassion of trying to see how we can make a difference. So in their huge, crazy busy schedule, they go to the food pantry once a month. We partner with Gladden Community House, and in addition to Lower Lights. And when they go over to Gladden Community House, they see what's in the food pantry for that week, and then create a recipe based on that food of what's there. So like eggplant, people are like, how do I cook eggplant? I'm not sure, you know, what to do with this, or I don't really like the taste. And so they'll be able to help people to, you know, access different foods. So then the same thing, they have a cooking demo, they get to have a free meal, and then also a grocery bag of goodies to take home with them with the recipe and the ingredients. And a lot of people are saying how, well, they're sharing the word with everyone on the street and their family members and their neighbors, and so it's now becoming more of a true grassroots. So now they're telling people about the stress management classes, and then the stress management classes are telling people about the cooking classes. And I was trying to explain, this isn't just like you come to a cooking class and you leave, because it's part of a bigger mission, and we want everyone to feel connected and to feel like they're a part of something bigger. So we had a woman that has been really involved in the class, and she had a stroke, and she was in tears talking about some of the different things that had happened as far as going to the doctor. She didn't think she was going to have a lot of mobility. She's eating better. Her blood pressure's gone down. Her stroke symptoms are starting to diminish, and the doctor's like, what are you doing? Like, what's changed? And she's like, well, I'm eating better, and I'm eating nutritiously, and I'm also like, I'm breathing, I'm doing deep breathing activities. And a lot of people will say in some of our stress management classes, we do a lot of movement and breathing and some basic skills, and people will say they've never, ever felt that relaxed, ever. Like a lot of us walk around not breathing, right? I mean, I hope we're breathing a little bit, but we just go so fast, and it's our society. And at this point, when, you know, people everywhere of all different backgrounds will say, well, how are you doing? You know, and it's like, oh my gosh, I'm so stressed. I have so much on my calendar, I just don't have enough time. And have you ever heard anybody say, when you say, how you doing? I'm so relaxed. You know what? I have nothing on my calendar. Like the whole week, I have nothing. Actually, for the next 3 months, I have nothing on my calendar. There is a societal push, and we keep going and going and going. And then you add on top of it, you don't have the resources, you don't have access, you don't have the money or the transportation or the childcare to get. So the stress just starts building and building and building. And so what this center is designed to do is try to help to alleviate some of that, and then people can make different choices, and people can start. Actually, there's my last story, and I'll be done. Is there's a woman that her husband had been murdered in a horrifying situation, and she was trying to. She'd been in the house, and she'd been stuck in the house for a long time, and she was connected to one of the mental health centers. And she's like, I've just been so depressed, I haven't been out of the house. So once she got connected to the programs, she started to do the cooking classes, and also the Tai Chi and the breathing and the stress management classes. And she's just this bright light. She comes in there and she just talks about how just being able to take care of her health and being able to share that with other people, she just has seen this huge transformation. So now she's like, how can I get involved? How can I like be a volunteer? So now she's one of our volunteers, and we're so new, and we're so, you know, still beginning, but I really believe in wellness and prevention, because a lot of times when we wait until it's too late, then the chronic conditions, it's just too hard to change. So if we can catch things before it's too late. So That's about all. There's a lot of exciting things happening, and like I said, partnering with so many people, and we're grateful for your time, so thank you.
Is there a particular initiative that you're looking for funding for?
Great question. Because we have such a growing list for cooking classes, I speak Spanish, and Rachel does too. We do a lot in the Hispanic community. Eventually we'd like to have a class in Spanish for, they have, Local Matters has a Spanish period class with all the recipes in Spanish, but also just in general for the cooking classes, with these 6-week series. You know, it's expensive and it's a best practice. They do a pre and a post test. It's very, very thorough program, and so being able to have some funding for the cooking classes would be extremely helpful. And then the Moms to Be program, it is helping a lot of people, women that have been involved in human trafficking, women that have been involved with domestic violence cases, and so many different types of things, and a lot of poverty, people that don't have food for their kids, they don't have a playpen, they don't have, you know, a high chair, some of the basic needs, and diapers, and all of those really basic things. That's what we, yes, okay, we'll do that. And
we're right over there by Holy
yes. Well, and Moms to Be staff, they're with Ohio State, and they probably already are doing some of that, but I'll make sure to let them know that too. And being able to have so many programs with the Moms to Be program, because we're partnering with Ohio State, it's so fascinating to watch. We do the cooking demonstrations there too, and they meet every single week, and really teaching people how to have healthy babies, and also how to be healthy themselves. And so they look at nutrition, they look at their stress, they look at the whole person. I think that's what our whole center is doing, is looking at the whole person.
Could I say one thing about, just piggybacking on your question about the diapers? The young women who are going through this program, we're partnering with them as well, and they're referring their young moms to go to our New Directions program. We have an actual contractual agreement to provide them with services for 30 of their women over this next 18 months. But they are often very fearful of going to a lot of different organizations. And one thing that we have done to address that need for the diapers is something you might think about. People on my staff, when they have hosted a baby shower, they have invited the people who come to bring an extra package of diapers to keep the bum dry of another baby who can't afford it. And then they collected those and then donated them to the Moms to Be program. And that's a great thing to do. I've done 2 showers in the last year and done that, and it really works well.
It really makes a difference. We've had a lot through that too, and a lot of people are excited about it. But there's just always, you know this for funding, in order to continue these programs and serve more women and have, you know, food or resources or transportation vouchers. And we have, last thing is, a lot of homeless women through this program. And so we're trying to get a coalition together to say, look at all these pregnant moms that don't have any place to live. So how can we connect them to the right resources? So.
Other questions?
There was a young intern from your program who's a student at University of Notre Dame on St. Gabriel Radio at noon today. And she was talking about, you know, going out into the community and working with the homeless, and it was, you know, so timely because she was just on.
That's interesting, because that must have been Alana, because she was just there for the summer.
Right, yes.
Oh my gosh.
I
didn't know she was on.
She's from Massachusetts,
yeah,
I think.
Yeah.
And oh my gosh, she was so well spoken, and she couldn't say enough good about the program.
Oh, that's great to hear.
And about the good that's being done with the homeless.
The staff, I mean, all of our staffs, I'm sure, you know, there's just so much compassion that people really have a heart for what we're doing, so.
Yeah, others?
Be respectful of time. Thank you so much.
Did you talk about cancer survivor offerings? I didn't hear.
The cancer survivors, patient navigators, cancer survivors. I did, but it was just quickly. But we do have a lot of cancer survivors and recently diagnosed that we need to help, you know, diagnose women. So we have the breast prosthesis available and the bras, you know, for women that go through that, and genetic testing as well happening at the center. So thank you.
There's a lot of great things happening there. I have the privilege of going to one of their cooking classes a few weeks ago and got to meet the woman whose husband was murdered, and she started telling me about all the ways in which she's volunteering. It's amazing. And she's even volunteering in some other organizations in the community that have met through our collaborators program here. She was incredible. And then another woman who's become her friend because they met at cooking class went on to tell me about her recent diabetes diagnosis and how she was really distraught about it. She began exercising because she liked to do water aerobics, but then she found the cooking classes. She's lost 30 pounds. She's taking no medication for diabetes, and the last time she went in, she didn't test, you know, I don't know what the number, high enough for her numbers to register as diabetic. So, you know, she has to keep going back to maintain, but her doctor kept saying, "What are you doing?" And she said, "I'm just going swimming. I'm eating better." So, and there were bags of, the other thing that I love about this program is there were bags of fresh produce there that were from the Franklinton Community Garden. So people of the community grew the food and used the food to cook with in the classes. The last program we're going to tell you about is Women Affirming Women. This is another great program of women obviously helping each other. And this is Mary Felice.
Hi everyone. I'm the last. I'd like to thank you for inviting Women Affirming Women and myself this evening to share a bit about our organization. I feel honored to be invited invited for the first panel of the Marthas, and to be included with this group of nonprofits that all do such wonderful things in our communities. Thank you. I would also like to commend the Marthas for recognizing that when women come together, women get things done. Pope John Paul II always had a soft spot for women and what he called their feminine genius. In his letter to women, he thanks every woman for the simple fact of being a woman. He recognized that women enrich the world's understanding and help to make human relations more honest and authentic. He went as far as to say that we are instrumental in creating a civilization of love. And as a matter of necessity, we must play an increasingly larger part in the solutions of the series of problems that plague our world and our future. So Marthas, we thank you. Women Affirming Women has a similar outlook on the role of women. In particular, we focus on mothers. In recognizing the role mothers play in society, we understand that by serving her, we are in turn serving the entire community. A woman's role is mostly associated with significant moral virtues that are critical to human development. These are virtues that are most often responsible for developing concerns for others, the willingness to sacrifice one's own interest for the others, the ability to read a situation, and the talent of being able to recognize the needs of others. In helping to improve the quality of life for our women, there is a positive effect on their children, their families, churches, schools, and their communities. If the mom of the family is not happy and healthy, the effect is felt throughout the family. Let me begin actually by asking you a question. Have you ever gone on vacation? Have you ever gone away with your girlfriends? Moms, sisters, daughters? How was it? Awesome, yeah. Don't you come back feeling refreshed, with better clarity, energized, and feeling like you're better able to tackle all that awaits you at home? Yeah. Now, who loves their girlfriends? And what you get from them, you get support, friendship, a sense of belonging, love. Yeah, that's just what I thought. These are things that some of us just take for granted. But the ladies we serve lack these luxuries. We serve the marginalized of the marginalized in the Columbus area. In a low-income community, it's the moms that lack the most. In any community, actually, as we know, it's the moms usually that lack the most, because mothers always put themselves at the back of the line. So think about it. Moms put themselves at the back of the line, and we're not talking about the affluent or the middle class. We're talking about the very low income, the poor. And the mothers are the poorest of the poor. So we're talking the marginalized of the marginalized. She's always way down at the bottom. In addition, which I think you touched upon, over 80% of this population has no male by her side to help her with the finances or the load, or to carry the load. It's all up to her. For the past 15 years, change this. Oh, why did we end up there? For the past 15 years, 25 low-income and disadvantaged women have been invited to attend a 4-day vacation at St. Teresa's Retreat Center. By removing them from their daily stresses of their lives, the goal has been to help them reconnect with their human dignity, which comes for us being created in the image of God, renewing their spirits, and building community. Many come feeling despair, hopelessness, disconnected and alone. Isolationism is a common ailment that we see, which I think we spoke about that before. From the minute they arrive, our ladies are being served. Sometimes most have never experienced this before. We take their belongings, we show them to a private room that's just for them. We ask them to participate as little or as much as they want to. Some may just want to sleep the entire time, and others are like little girls on their first sleepover, and they don't want to miss anything at all. We bring in spa activities, spa services, activities, crafts, we serve them meals, and we show them love. We hold prayer each morning, and a beautiful closing ceremonies in the chapel that speaks to how special each and every one of us is, and that they are not alone in this world. There is really no formal education during these 4 days, but boy, I tell you, they learn a lot about themselves. They learn about themselves, what their dreams are, that they are loved. Our overall mission is to build community and enhance the lives of low-income women by educating them on what it means to live a truly human life, to recognize and break through the barriers that are holding them back, and to help them realize their potential, or at least see their potential. These 4 days open up the door to do this. I'm not exaggerating when I say that we actually have 100% success rate on these 4 days. Every single person leaves saying, I loved this, and they leave feeling like, oh my gosh, I can do so much now. Everyone leaves feeling loved, having made friends, and they now have a sense of belonging and determined to make changes in their lives. But we know how that works. As soon as we get back into the thick of it all, you're once again drowning. Well, imagine this group of women. So what we developed was an after respite program. Once a month, all 400 women are invited back to St. Teresa's, and it's here that we continue community building, but we do introduce education and connection to service. This second program is really easy to understand. Our society is used to seeing development as an increase in income, so education and service connection makes sense to people. It's a program they can understand. What I really want to focus on is on the 4-day respite program. This is where our organization has a difficulty in getting financial support. I've had it called fluff. I've heard comments like, well, yeah, I'd like to get a 4-day vacation too. I need it. But it's more than this. The respite is a short period of rest and relief from something difficult or unpleasant. It's a period of time when something difficult or unpleasant stops or is delayed. It's an interval of rest and relief. We offer her a breath, a breath that allows her to inhale and recognize the beautiful divinity that resides within her, to be able to experience and listen to the Holy Spirit. As an all-inclusive and non-discriminating community, over 60 volunteers come together and create a loving, welcome, and safe environment for our ladies. The transformation that happens over the 4 days is truly a miracle to be witnessed. As already explained, most come with hardened hearts, not trusting and just not sure what's in store for them, because it's just too good to be true. A vacation, spa services, no cooking. But over time, due to the love they receive, they allow themselves to become vulnerable. They start talking to one another and realize that there's similar struggles going on, not only between the participants, but by the participants and the volunteers. We're all women. We all have our crosses to bear. I probably deal with the same things raising my kids as you guys do. What really breaks the ice is our first icebreaker. It's a pool party. All these women come together, they've never known each other, and some of them have never been in a pool or swam together. They revert to being little girls. They laugh, they splash, they just play in the water. We top this off with a great barbecue from Bob Evans. The dessert from Bob Evans is saved for the night, for the dessert night, and because there's food. Oh yes, let me tell you, there's lots of food there. Through food, we feed our souls, and by breaking bread together, the bonds are created. Over the 4 days, we bring in spa services to celebrate their bodies, makeup, manicures, massages. We do crafts to open up their minds and get their creative juices going, like jewelry making and vision boards that have helped women recognize their talents. We have evenings, events like karaoke, journaling, laugh yoga, bunko night. Throughout the 4 days, we see a lot of laughter, but we see a lot of crying and sharing. The support network starts to take place and friendships are formed. 3 years ago, we had 2 women. A pregnant woman came and she met her very best friend there. It ended up that when she went into labor, this friend helped her and she became godmother to the daughter. These 2, the one who had the baby, ended up going back to school, and the other one finished her early childhood education and started her own daycare. We hooked her up with our partner of ours who helped her get a small loan and helped her to run her business. So the connection all started with us. I mentioned that there's prayer. The only thing we ask over the entire 4 days is that you participate in attending our opening orientation, which includes a non-denominational prayer, and our closing prayer that takes place in the chapel. Other than this, we offer prayer each morning in a separate room for those who want to attend, and many do because it's a chance to share. There's soulful sharing. The final day, though, is my favorite. We have one large birthday party that celebrates each and every one of them. Each receives a special gift just for her. Many are completely overwhelmed by this. Most of them have never even had a birthday party or ever received a gift before. It's unmanageable and they wonder why. Because they're loved and a child of God and we're all sisters. You may ask where these ladies come from. We have over 23 partnerships with various organizations throughout the city. Community housing, social workers, faith communities, schools, housing developments, and organizations like New Directions, and actually, Moms2Be. And where do we get our funding? That's a tough one. Each year we receive $3,000 from the Shalom Grant, the Dominican Sisters. And we also have items donated to us, like Jenny's this year, barbecue from Bob Evans, and pizza night this year was complimentary of Papa John's. Other than that, we rely on donations from friends, family, individuals as yourself. As explained, this part of the program is difficult to sell. It's hard to explain that this actually opens up the window to allow us to swoop in and touch the woman's soul. It allows us to renew her spirit, give her hope, and help her to see her potential. It fits into the overall program that focuses on the element and to aid in shaping her life. But without boring you too much on the science, we rely on what's called the intuitive idea of human dignity. And we adhere to the World Health Organization's report on human development. The Women's Respite Program may sound like a big sleepover, but it's truly a strategic plan that has been developed in order to support the overall program geared towards improving a woman's social goals in order to meet what's called a capability threshold that will allow her true human development. And I've provided a list of what the capability approach is with what I've handed out. By adopting this philosophy and measurement guide and coupling it with key principles of Catholic social teaching, mainly solidarity and common good, community and participation, and the virtue of charity or love, our program has been devised to focus on the main elements of a woman's life. I'll close with just one last story. On the final day of our closing circle, We allow each woman around the circle to say, what was your favorite part of these 4 days? And my first year, there was a woman who said, I loved sleeping on a mattress. And I looked, and she said, yeah. She said, I've never slept on a mattress. I realized that I deserve to sleep on a mattress. And we were like talking. It's like, yeah, she had never slept on a mattress. The mattress, the one mattress she had, 3 of her kids sleep on it. The rest on the floor. She's been on the floor all her life. You don't know what you don't know. I'm thrilled to share with you that the UN's most recent report on human development states that poverty throughout the world is actually decreasing. They attribute this to 3 things: the power of people themselves, civil society actually pulling itself up, and third and finally, women empowering other women. I thank you for your time, and I hope you look us up on the web. And like our page. Like our page. Thank you.
Any questions? I have a question. When did you start this program, and obviously, how many people have attended over the years?
We just celebrated our 15th year. So it's been a little secret in the Columbus area. And the reason, oh, sorry.
It's 15 years that we've been doing this. Like I said, it's a little secret. And the reason we only hold 1 a year is because of funding. It's very difficult. We've got 2 volunteers actually here. We have, out of the 60 volunteers, they all do from little things to bake, from baking cookies to big things like these are 2 team leaders. They have a whole group below them that will help them. One's hospitality and the other one was evening events. But it's tough because it's hard. It's not as if we get this money and we can go out and buy things. Kathy does hospitality. Each woman comes in and she gets on her bed a hospitality bag, shampoo, it fills it. Pool party, we have access to bathing suits and all that, except they don't come with bathing suits. We scrounge for months to get for just this one thing. If we had the funding, we could go out and get all those things. If we had the support from organizations, we could just, and we've got the partnerships with groups, like Homeport's one of our partnership, and they would love to have one just for the group of women that are from Homeport, so then they can continue it and have, because they come and they're not trusting, so they don't have their friends. A lot of times, the woman lives right around the corner and they don't know that. So we can't do that because we don't have the funding to have that.
I was just going to say, one of the things when I first started, which was just this year, I'm just brand new, but that totally, absolutely surprised me more than anything else is that these women, the first thing they would tell you, and you would think it would be the opposite, but they don't trust other women.
Yeah.
They totally do not trust other women, and she's not kidding. When they come in, they basically don't talk to anybody because they don't trust you, they don't know you, they don't trust other women, and by the time they leave for the 4 days, I have chills, goosebumps just thinking about it. By the time they leave for 4 days, they have become friends, and they find friends who they can trust. The first lady that told me that, and when I said, oh, would you want to pray? She said, I don't trust women. And I thought, wow. And then we talked about it, and all of them were, I would think it would be men. You know, I don't trust men.
Yeah.
But it's not the same with low-income women. They don't trust because women will steal things from them, including their man.
Yeah.
You know, I mean, that's
it's a matter of survival for this population, so they don't trust anyone. It's funny talking about they don't know who to trust. Flora from New Direction came this year, and she told us at the end of the 4 days, she goes, you know, I had a secret code for my husband. If I called and said, oh, this word, he thought I was kidnapped. It was just in case, because he said, I didn't know what was going to happen to me. So she goes, this was the word, you know, this is happening, you got to come get me. No,
that's great. The thing I love about this ministry is that it was born from women of a parish.
Yeah.
It was women in a parish who thought, you know, we're so blessed to have each other, to have these things. How can we help other women have them? So this is a parish-rooted ministry. I think it was born out of Seton. Is that right?
It actually started in Stella, Niagara. Still in Niagara, and they came down, and it was the St. Anne's Hospital started there, so there's an association. And then the group here, I don't know if it's Seton, it's Ann Rapp and
St. Philip's?
There were, I think,
I don't know the parish it was, but it was through a parish.
The east side, it was east side, and I think that there was a parish that then brought other parishes together. But this is women in parishes who said we need to help each other.
Yeah.
How can we do that? So
They recognized how blessed they were, and they said, you know, they sat around, they said, isn't this nice that we can do this? It's too bad others can't. And they said, well, why? Why can't they? Let's do it for them. So they started. And this is the way God works. What they didn't realize was that they were developing a program. So what I do behind it is the science behind it. They were developing a program that really fits in what the United Nations uses to measure human development, and they make sure that these women have all of these things in their life.
any other questions, Ginger?
It must be, I'm just thinking about a regular weekend retreat out there is $125. You're doing so much more, so I'm thinking it's probably $300 per woman.
That's from start to finish, if I didn't receive anything. With the donations and everything we have, it's not that at all. Like, we get items donated. But it costs, we priced it all out, our budget is $15,000 for 25 women. That's everything. Food, everything we give her. I mean, she walks away, she gets a Kroger gift card to start off, and so.
How does she get there?
How does she get, we have drivers. We have drivers, they get picked up if they don't. That's the only thing that we haven't gone that next step. What our plan is to partner with the camps, so we have slots, have kind of like a scholarship that if women can't find, help, which usually they do, then they, we'll get them in the camps that coordinate the same days. But I'll tell you, this year our wait list was over 50. So there is definitely is a demand, and we haven't advertised. It's just word of mouth. We can't. I have no money. So, yeah. No, I'd like to. I'd love to do this more, because then what we really do is handhold them to a point where then we can say, go to this here and go to this. And this is exactly, I've got 2 that are in the E3 program, and I've got one that starts tomorrow, and I'm not sure when that the New Directions program. That would never have happened. That would never, they don't know about this.
And I want to point out that this is $500 a woman who's going to St. Therese Retreat Center. She's not going to Hilton. She's not coming downtown. She's not going over to Easton or Polaris. And you should also know that in a meeting I had just last week, their boiler is in desperate need of repair, and it's going to be over $1 million. This is a hardship for the diocese. And so if the diocese can't come up with the money to fix the boiler system, we will have a bigger problem for St. Therese Retreat Center. So this is a domino effect of us all supporting each other in these different ministries, and how does it affect one another? If St. Therese closes, where will these women go next? This is why we have St. Martha Giving Circle. This is why we have Bridge the Gap. Bridge the Gap is on our website. For any of you who are interested in learning more about it or funding personally, there are all the responsive grants. Right now it's just responsive grants that are listed, but there are people like Women Affirming Women who have applied for grant funding from the Catholic Foundation. They've received some or none little funding from us. We just don't have enough to go around, and we addressed that last spring. The organization's applications, or a summary of their applications, are posted on the website, so you can read what they wrote to us and their need. You can see how much money they requested, and you can see how much money was given to them. So if you want to make a personal donation, or you know other people who want to make donations, direct them to our website, because they can help fund all these projects in need. All of the organizations who you talked to tonight are people who applied for grant funding from us. Some got funding, some did not. Nobody has got 100% funding. I can say that.